How to understand CML progression phases. Imagine a journey through the different stages of a disease that can change how it behaves and how doctors treat it. Chronic myeloid leukemia, or CML, moves through three main phases: chronic, accelerated, and blast. These phases are defined by how many immature white blood cells, called blasts, are in the blood or bone marrow, along with symptoms and lab results. In the first phase, called the chronic phase, the disease is usually slow and stable. Most people are diagnosed during this time because symptoms are often mild or even absent. Blood tests show mostly mature, functioning blood cells with fewer than 10% blasts. If symptoms do appear, they might include feeling tired, having anemia, or mild discomfort. Platelet counts can be a bit off but are not severely abnormal. This phase responds well to standard treatments, which can control the disease effectively. As the disease progresses, it enters the accelerated phase. Here, the number of leukemia cells increases and they become more immature. Blood tests show between 10 and 20% blasts, or sometimes basophils, a type of white blood cell, make up 20% or more of the blood. There may be new chromosome abnormalities in the leukemia cells, indicating genetic changes. Symptoms become more noticeable and can include increased fatigue, weight loss, fever, loss of appetite, and an enlarged spleen that causes abdominal discomfort. Blood counts may become more irregular, with very low platelets not caused by treatment. During this phase, the leukemia may respond less well to therapy, and the disease tends to become more aggressive. The final phase is called the blast phase or blast crisis. This is the most advanced and aggressive stage, where the disease resembles acute leukemia. More than 20% of blood or bone marrow cells are blasts, which are immature cells that can spread beyond the bone marrow to other organs. Symptoms are often severe, including extreme fatigue, bleeding, fever, shortness of breath, and a significantly enlarged spleen. Blood counts are severely abnormal, and the disease progresses rapidly. This phase requires urgent, intensive treatment to try to control the disease and improve quality of life. Understanding which phase a person is in is vital because it guides treatment choices and helps predict how the disease might progress. Most patients start in the chronic phase, where targeted therapies like tyrosine kinase inhibitors can keep the disease under control. When the disease moves into the accelerated or blast phases, more aggressive treatments are needed, and closer monitoring becomes essential. Doctors use blood tests and bone marrow examinations to determine the current phase. Regular checkups are important to catch any signs of progression early. Remember, each person's experience with CML can be different, so working closely with healthcare providers is key. They can help interpret test results and decide on the best course of action based on individual circumstances. In summary, CML progression is marked by increasing numbers of immature cells, worsening symptoms, and changes in blood counts and chromosomes. Recognizing these phases helps doctors tailor treatments and improve outcomes. Always consult healthcare professionals for personalized advice and management.